Hey, it's Peter Morelle, your patient advocate. I am so thrilled and excited to kick off Healthcare Awareness Month with my good friend, Congressman Joe Morelle of the 25th New York Congressional District.
There's a lot of them, Peter.
There
Don't have to worry about
so
that.
many of them. I was one time called, how many congressional districts or how many districts are there?
Altogether?
Yes.
435.
Yes. I was one time called the 436th since I'm here so frequently.
I suspect that you're better equipped to do this job than many. So
Well, I'll plead the fifth on that one. But anyway, it's so great to be with you today. I know you are part of the Social Determinants of Health Caucus, and I would love to know what is going on in the caucus for the 118th Congress.
Well, one of the reasons I joined it is because I care deeply about social determinants of health and spent time, as you know, in the New York State Legislature. For a period of about 6 years, I was the chair of the Assembly's Insurance Committee, which dealt with all different kinds of insurance, but certainly health insurance. And that's really where I came to appreciate how we could not only reduce healthcare costs, but that we could have better outcomes for patients, and in addition, really have a better experience for patients and even for providers if we really drill down and started thinking about all the things that affect someone's well-being and their health. And that certainly includes what we call the social determinants of health, which I think most of your viewers and listeners would know are the things that people don't necessarily consider healthcare directly, but certainly affect it. So transportation,
Right.
And all the kind of housing, food, and nutrition. Those are things that people might not necessarily directly consider part of healthcare, but have a huge impact on a person's well-being. So I joined the caucus here largely because I'm deeply engaged back in my hometown in Rochester, New York, which I have the privilege of representing, in a project that really is trying to pull together social, education, and health related services so that individuals who have different challenges in their lives could be treated as individuals. It's holistic, but it's also individualistic in that it's really a way to design custom care for people. And many of those things involve social determinants of health. So that's why I'm so passionate about it. And I felt adding my voice here in Congress and using the experience that I have back home would lead me to be a better representative and a better advocate for healthcare needs for people in my community and across the country.
Well, thank you. You do such wonderful work. So grateful to know you, and thank you for everything that you do.
Thank you. Thank you for everything you do.